Hi, everybody. This is Brooks Lindsay. I am the founder of a website called Debatepedia.org, and I wanted to walk everybody through some of the pros and cons of one of our more recent articles on health insurance co-ops or cooperatives. Uh, just backing up for a second, Debatepedia, it's a pro-con encyclopedia. What we do is distill the main arguments that are found in editorials and opinion pieces and essays and speeches and books and so forth into a single article. So we've done this on the co-op debate, and I want to jump right into the arguments. Uh, I guess first I'll start just defining co-ops. Co-ops are nonprofit organizations that are membership based. So every member who is in a co-op can vote on the board as well as the leadership CEO, let's say, of a co-op. Very democratic institutions, and most important, nonprofit versus a health insurance company, which is the main alternative, and versus a third alternative, which is a public option. The most important thing to consider is that co-ops have been proposed by someone called Kent Conrad, Democrat from North Dakota, as an alternative to public health insurance, right? And the main reason for this is that public health insurance was considered too contentious at least the time in July and August and September of 2009. Many people debate that. I think public option is still on the table. The Obama administration is still pushing it, but Ken Conrad put it up as an alternative. So it's not government run and it's not privately run is one of the main reasons. So it's considered almost a compromise. Big questions. Is a co-op competitive? Can it compete against a health insurance company? Public option is widely believed to be capable of doing that. And examples from abroad demonstrate that. Can co-ops compete as well? There are two examples in the United States that are worth considering. One is Group Health, which is in the Puget Sound or in the Seattle region, and it has about 550,000 members. There's also one called Health Partners, which is in the Twin Cities. It's a little bit smaller, about the same size. Big successes, but there are only two. So most people say, if there are only two examples of successful co-ops, can we really believe that these things will scale? Can we believe that they'll scale to a point where they'll have an impact on the 47 million uninsured Americans and 75 million insured Americans that don't have great insurance and are struggling to pay their insurance? So I want to read, I guess, a quote from Sanjay Gupta. He says, and this was in August of 2009, he was on Anderson Cooper 360. He says, looking at a lot of these historical knowledge of co-ops, unless you get scale, hundreds of thousands of people participating, it is hard for a co-op to compete against a private insurance company, which is why the people who are such supporters of the public option are crying foul. They are saying, look, the public option was a national option, and at scale, hundreds of thousands, if not more people, that could compete. A co-op, even at a regional level, can that compete? So his basic point is maybe it's not that reliable of an option to scale to the size that we need it to scale to. 47 million people uninsured, we need it to be able to fill that gap. We know that a public plan is capable of scaling to that size. And here's probably the biggest argument against co-ops. When you look abroad, you do not see co-ops as a significant part of the systems that are out there. So if you look at Europe, you don't really see them. And let's keep in mind these are the quality systems in the world. So United States ranks 37th the world among every country in terms of its healthcare system. Basically dead last among industrialized countries, which means that most of Europe is ahead of it, if not all of Europe. And every single one of the systems that are ahead of the United States basically has a public option, at least health insurance wise, for a single payer system. So they have the public option in there, and they're superior as far as ranked by the World Health Organization in its 2007 rankings. So when you look abroad and you see the public option out there and you don't see the co-ops among the best, systems in the world, it raises some eyebrows. I want to move into why this was proposed. it's proposed as a good alternative and a good compromise. So the public option has been very contentious. Many people say there are only 57 votes in favor of a public health insurance option. You need 60 to pass the filibuster-proof majority, which I think is a sad situation in its own right. But anyway, if we only have 57, maybe we can't pass it. That's very debatable. I think 60 is a possibility. But if we were to say, okay, we can only get 57, maybe the public option can't pass, maybe the co-op is the only alternative. And the reason it's seen as a nice alternative is that there's not uh, the government involvement. There's this huge fear that the government and its bureaucracy, if it involves itself in healthcare, is going to be, you know, doing things like death panels and all these other things. So government bureaucracy is disdained in the United States at a high level. You won't have that with co-ops, at least not at the degree that a public auction would have, and you wouldn't have private companies. It'd be nonprofit. So certainly there are good reasons to have a nonprofit system because for-profit health insurance companies have certain issues because their bottom line is the bottom line. They're for-profit. So when it comes to giving, money to someone who's making a claim that just had a service, they have an incentive to deny that claim or at least to cut it back as much as they can to save costs and so forth and make more of a profit. So with a nonprofit cooperative, you bypass that and it's more about health, care, less about profits. That's kind of a good concept. But again, despite the fact that it's a good concept and should exist and should be encouraged, people like Nancy Pelosi say, this just is not a sufficient alternative, even though it's great. So we have an argument here in this article that says, let's see, nonprofit co-ops are great, but no substitute for public insurance. So this is the header that we have in our article. And then Nancy Pelosi says, if someone thinks a co-op can work for their state, let them go and do it. But there are no substitute for public insurance. So she's saying, let it happen. Let's maybe even encourage it. At least some people are saying, let's encourage it, maybe give subsidies and so forth. But it cannot be the core of healthcare reform. I think I'm going to stop there just because of time constraints on YouTube. There's so many arguments in this article. We've distilled probably 40 unique arguments and major quotations out of about 20 or so pro-con editorials and opinion pieces. So take a look. We'll come back with another good article and another good YouTube sesh in probably a week or two. But again, debatepedia.org. I'll post a link on this video. All right, take care.